Thanks for joining us today in looking at a common problem, Meniere syndrome. Why do so many people have Meniere's? Well, we don't really know completely, but we're going to help you attempt to decipher if you battle or have a family member that battles Meniere syndrome. It's very complex. First of all, you need to see a physician, you need to see an ENT, make sure there's not any damage in the inner ear, tumors and such. But once that's been defined, once that's been defined, what do we do? Are there more integrative approaches? And I believe that there are. So Meniere syndrome, number one, there's an inner tissue, that the sac that actually in the inner ear that becomes damaged. It's also referred to as an endolymphatic distension syndrome. So all of that doesn't really matter to you. All you know is you have these symptoms of Meniere's, of movement and so on, and you have these symptoms and you don't know what to do about it, and it's pretty much chronic. It's episodic for many of you. It can hit you for 20 minutes to an hour. It can last up to 8, 9, 10 hours continuously. So Meniere syndrome for some comes and goes quickly. For others it stays. It's a huge, huge debilitating component of your life when it does. What's some of the causes? No one really knows, but it's also believed that bacteria, spirochetes like syphilis, can actually create this damage. Bacterium, viruses, and also even head trauma has been also implicated. Sometimes hearing loss is involved in cohabitates, and tinnitus, that constant roaring, humming noise for many people, kind of can coexist and cohabitate and aggravate and create more of a Meniere syndrome problem. So, in looking at this with Meniere syndrome, what can you possibly do? Number one, I think an area that we just don't realize and we don't look at today, food allergies and food intolerances. So number one, we probably put you on a type of an elimination diet to see if there are triggers for you with foods. Number two, we'd put you on a sodium restricted diet. We already know that already many physicians already recommend this, and there is a place for it. You might wind up being on a little bit of a diuretic, a water pill that helps to excrete and pull excess fluids out. That's debatable. Some folks do respond, others do not. I think the first thing is a little bit of sodium restriction. Number two, elimination diet. Food allergies and food sensitivities play a huge role. The other area that is grossly misunderstood, many folks with Meniere's suffer from insulin resistance, meaning that their blood sugars are being managed by high insulin. They also have issues with high triglycerides, high cholesterol, and reactive hypoglycemia. What does that mean? That means that I love my sugars, I love my carbs, and so I secrete a bunch of this insulin to manage my blood sugar, but after my blood sugar has been managed, then what happens is I have drops in blood sugars, reactive hypoglycemia. When the blood sugar drops for some folks, we find there's some studies, some case studies have been done, that when their blood sugar drops, that's a trigger for Meniere's. So what do we want to do? We want to stabilize your blood sugars. We want you to eat consistently 3 meals through the course of the day. We don't want you on a high carb, high sugar diet. I might put you on an elimination diet. Make sure that you don't ingest a lot of foods that have a lot of preservatives, colors, dyes, and the like. And do not let your blood sugars do this. When these bottoms hit, that's a problem. We want to keep your blood sugars more stable with a glycemic controlled type of diet. What about supplements? What about nutrients? Oh, back to the cholesterol and triglycerides. If you have those areas elevated, especially triglycerides, that's an area that we need to deal with, and we have some natural agents, Omega Advanced, our berberine complex can help you there. What about some natural approaches, natural nutrients? Beta histine is technically a prescription. If you're in the state of Pennsylvania, we could probably help you with that. If not, you're out of state, you probably have to see if one of your practitioners in the state. It's a specially formulated product. We compound it in the lab. Start with low doses. It's a form of an antihistamine, more tolerated. We start low, titrate it up. Very helpful with Meniere's. Number two, a lipoflavonoid complex. We use a specific formulation of lipoflavonoids that seem to help that inner ear, that sac, flavonoids always have a protective effect to the vasculature, reduce leakage. Lipoflavonoids can be helpful. Two other areas that have been helpful over the course of time, believe it or not, are thiamine, which is B1, and niacin. Now, what we will do is start with a low dose of niacin, like 50 milligrams a day, then increase your dose and then maybe put you on like a time release of 500 milligrams a day. Meniere syndrome. Is there a one-shot answer? Just take this supplement or that supplement? Not really. Do I have to combine it with some type of food elimination, balancing blood sugars? You'll find that many folks that have Meniere's also have weight problems, as mentioned, triglyceride cholesterol. They're possibly in some cases moving towards type 2 diabetes because blood sugar spikes and drops. So what would we want to do? We want to manage you from an ingestion standpoint, from a dietary standpoint, eliminate certain triggers, and then use some key nutrients that can help you possibly and hopefully eliminate some of the triggers. Meniere syndrome. I know this is a quick, short teaching. That's what it's meant to be. There's not a whole lot in the medical literature about approaches. There's no real medicine. I believe it's more lifestyle management. Stress can be a trigger here too, so we would always encourage you, how do you cope with and deal with your stress? I think we have some options for you. God bless you. Thanks for tuning in. Meniere syndrome, you have a family member or a friend that battles this, tell them to view. I think it'll help. If you want more specific help, you need to call our off-air toll-free number or send us an email at askjoedimatteo.com or askjod.com. Set up a time where we can go through specifics with you and try to help you work through this process. This is more to educate you that there are some answers for you. Let us help you with the specifics, not the overview. God bless. See you next time.